Hello everyone. In this video, I will give you a quick introduction about the Egyptian Knowledge Bank and what is the main application for the Egyptian Knowledge Bank in the clinical setting. Also, I will put some focus on an application that I think, is the most important clinical application inside of the Egyptian Knowledge Bank, which is called the Clinical Key. So, what is Clinical Key? ClinicalKey is an integrated clinical product. I will tell you what I mean by that in a minute. But Elsevier is a product of Elsevier, and Elsevier is a very popular publisher that owns many journals and books. Also, Elsevier owns many other products like Mendry, Cyval, and others. However, Clinical Key is mainly concerned with uh, providing clinicians and pharmacists with updated and recent data. What is very unique about Clinical Key is that it can provide the consumer with different levels of abstraction according to the complexity of the question being asked. So you can find tertiary resources, secondary resources, primary resources, all in a single product, in a single place, which is a very brilliant and potent idea. So, what makes Clinical Key very powerful? You can find disease-oriented questions. There is a database called the Clinical Overview. If you're searching about a disease like hypertension and you are asking what are the risk factors of hypertension, what is the prognosis of hypertension, what is the best treatment for hypertension, you can find all of these questions in the Clinical Overview section of the Clinical Key. Also, you may be asking a question related to certain medication, like propranolol or something. You may be asking about the dosage. You may be asking about the adverse effects. What are the adverse effects? What are the contraindications? You may be asking what is the available data for pregnancy and lactation. You can find all of these in the drug monograph section. Also, what is very potent in Clinical Key is that it can provide you with a search engine, and you can search in different other resources that is not tertiary in some way. So you can search for guidelines that is related to the keyword you have entered. Also, you can search for books that are provided by Elsevier itself, and you can open the books online through the Clinical Key for free. So you don't have to purchase the book or download it or something like that. Also, you have access for all the clinical journals for Elsevier itself through the Clinical Key. So if you are searching for clinical trials or systematic reviews or meta-analysis that are related to your question, you can find the results in the query you have entered. Another unique database in Clinical Key is called Multimedia and Procedural Videos. If you are searching for some image for the disease, or you are searching for how to diagnose a disease, or maybe you're searching for how to make a surgery or something like that, you can find all of these in Clinical Key. Another unique database in Clinical Key is called Patient Education. Patient Education provide a very patient-friendly information. I mean by that, the information is free from medical complexity and medical jargons. So if you want to make some print for a patient so he can take with him, if you are making a quick counseling or something like that, you can use Patient Education, and it's very versatile inside Clinical Key, and it's very unique also. The last thing is clinical calculators. Clinical Key offers many calculators that is very unique. Some of them are calculators related to dosing and what is the dosage that should be dispensed. Others are concerned with diagnosis. So something like scoring or what are the risk factors or something like that. All of these calculators are provided by Clinical Key. So the main idea of Clinical Key is that it's a search engine. Clinical Key itself contains many databases. However, it's a search engine for all the clinical information inside Elsevier itself. So you can find the clinical trials, you can find systematic reviews, you can find books, you can find media, you can find something in the specific databases inside Clinical Key itself, like the clinical overview database and the drug monograph database. But you can think of Clinical Key as PubMed, Lexi, UpToDate, and Dynamed Plus combined. It's a combination and integrated product for many services, and it's a very powerful idea. So, how we can access Clinical Key? Now we will go to the Egyptian Knowledge Bank. So, what is the Egyptian Knowledge Bank? The Egyptian Knowledge Bank is a national project that is under the supervision of the Egyptian government. The main objective of the Egyptian Knowledge Bank is to provide the Egyptian citizens with free access for resources. Either the resources can be helpful for students or researchers, or even normal citizens. So now you may be wondering what is so great about the AKB that makes the government put a lot of effort and money on it. Why it's a very big project and the government is investing a lot of money in it. Okay, let's give you a quick demonstration in this. Let's assume this is you and you want to access Clinical Key. You may access it directly, but now you have to pay some subscription fee for access of Clinical Key. Okay, that's fine. Now let's assume you want to access another resource like the New England Journal of Medicine. Now you have to pay another subscription fee for this reference alone. And every reference you want to access directly by itself, you have to pay for it. What the Egyptian Knowledge Bank is doing, it provides you with like mass subscription for multiple resources. The Egyptian Knowledge Bank itself contains more than 20 different resources from different providers and different publishers. If you're going to pay for every publisher by itself on your own, it's going to cost you a big fortune. However, through the Egyptian Knowledge Bank, it's free to use. So it's a very a big project. It's a very brilliant project. I encourage you to you now and to understand what is the main databases in the Egyptian Knowledge Bank, and you will find it very helpful. So, how to register for the Egyptian Knowledge Bank? You have to have your 14-digit Egyptian national ID number, either from your passport or your national ID card or whatever, but you have to have this right now. The other thing, you have to have a university mail, something that ends with .edu, .eg, or .edu, or whatever. Okay, so you have to have your university mail with you and your national ID. And now we will go to see how we can register for a new account in the Egyptian Knowledge Bank. So the first thing, you will type AKP .eg. Just bad internet. And you will have here on the right something called sign in. You will press on it. Now you have to press on this green button, new to AKB, sign up now. I'll press on this and I will choose this tab here, scientific research and higher education. Okay, press next. and then I will choose university and research centers staff member. By the way, you can use university students. I think there wouldn't be a big difference between those two tabs, but I will go with this one. Okay, now you will have a link here that say if you have your university mail, you can click here to register. So you now have your MIU mail with you, so you can click here. Now you will enter your information in the tabs here. So I will write my first name, last name, and email address. Write the mail again. I actually have account already, but I will go through this procedure with you. Maybe you find some difficulty. I will just write any number here, okay, and the national ID. Okay, and you have to choose your um birth date, whatever. Okay, I have a problem here. Let's do this right. 1994. Okay. As I told you, you can use university student or researcher. I don't care. Let's make it a researcher. I think if you select a researcher, you will have more access. So let's all register as a researcher to have what I have to see what I see. Okay. So let's say at a university. I'm a graduate student. I will type Misr International University. Here we go. The title, I'm a doctor, faculty of pharmacy, major. To find the message that contains our password. So I type here mail.miuegypt.edu.eg and I'll type my email. Okay, now for privacy, I will hide this window here so you don't see my private messages. Now, as you can see here, the first message from the EKB team, your new account. So I will open it. Let's see what this is saying. So it's giving me the username. The username is the same mail, and the password is this one. Okay, you can change this password after that. And so I will open this URL here. I will click on that, and I will enter my email. I'll just copy this one. Sorry, this one. And for the password, I will type 4C44AB. Okay. Now I will sign in. Okay, now it's asking you to enter another password. So I will type another password, confirm it again, then click on save. Now that's the new password and you have to memorize it. Click on save. Now, as you can see here, now we have opened the Egyptian Knowledge Bank. The Egyptian Knowledge Bank is basically a search engine, but it can also contain other resources and other references, and you can access these references directly. So, from the bar here, from the navigation bar at the top, I will select sources and I will select all sources just to see them all. And here you can see all the resources that are provided by the Egyptian Knowledge Bank. Now I'm interested mainly in Clinical Key, so I will press on Clinical Key and I will select the one here, the link called the Clinical Key. I will just press on it. And here we go. That's Clinical Key, and I will now demonstrate to you how to use Clinical Key. Now, to use Clinical Key, you can just type the keyword you want here or the keywords you want here, and it will search in all the databases that we have talked about in the beginning of the video. However, the first step I would recommend to make a new account on Clinical Key. That would be helpful in the reproducibility if I want to see how you searched for something or I asked you to copy your search results. You can just copy the search string you have entered, and this would be very helpful. So I would click here on register, just type in the first name, last name, and type my email. And select the password. And I think I have only to select I have read and understood the registered user agreement. Click on registered. Okay. Now I have account on Clinical Key. Okay. Now I have two other things appeared here: the saved searches and search history. That would be very helpful. I will show you how now. If I type any word here, let's say COPD. Okay, on Clinical Key, you have your results at the middle of the page, and on the left, you will have filters. I have selected all types, all databases, so there is no filters applied here. But maybe I want only to limit my results to systematic reviews. So if I clicked on systematic reviews, I will get only 314 match for the words I have entered. Okay, so I might click here, and all the results I will get here are systematic reviews. Okay, uh, I can clear that. I can select anything: books, clinical trials, guidelines, drug monograph, as I like. Also, you can narrow your search by date. Maybe you want something that is somehow more recent, or maybe you don't care about that, and you want all the results in the last 5 years. You can limit your search as you want also. On the right here, you can find one of the databases of ClinicalKey. It may be the clinical overview database. It might be a drug monograph if you have entered the medication here. It might be a recommendation for a book. It's just one of the relevant results will be presented here at the right. Okay, as I told you before, most likely we will deal with the clinical overview database and with the drug monograph database. So, clinical overviews is concerned with disease-oriented questions. So, if I'm asking you what is the risk factors of the disease, or what is the best treatment for a disease, or what is the drug of choice of a disease, you would select the clinical overview database. Let's look at the clinical overview database, and let's see how it's usually structured. Here in the clinical overview database, things is organized monographically. You can Sometimes you have something called urgent action at the right. Uh, it's about if you are having a crisis, or maybe you have something urgent, or some sort of exacerbation or something like that. You will find what is the action to be taken for this condition here at the right. Also, you will find all the sections here at the left in the navigation. You can find how to diagnose the disease, for example. You can find clinical presentation, history, physical examination. You can find all of the things that is related to the disease. Okay, that's the clinical overview database. Now, let's try to search for another thing, maybe at the drug monograph database. So let's write a medication like atenolol. Okay, as you can see here, we have the drug monograph of atenolol. So it's something you can resemble it with Lexi. As I'm opening Lexi, I will open the monograph. But you can notice here that you get search result for hyperthyroidism and atrial fibrillation and many other different diseases and many different other databases that have mentioned atenolol. Okay, so this result, for example, hyperthyroidism, you would find atenolol in the monograph or in the database of hyperthyroidism. So now, if you are interested only in a question that is related to the medication, you are only looking for the drug monograph. So you can narrow your results. You may just select the drug monographs when you're searching, just from here or maybe down there, and you will search for that. Now all the results are for drug monographs. Maybe it's atenolol in combination, or maybe you have some other atenolol mentioned inside of the monograph of the other medications that are presented here. As I told you before, ClinicalKey is a search engine, so it will return everything you have searched for. If atenolol matched any word in any monograph or any result, it will return it to you. And as you can notice here, the filter have selected drug monographs, and you have only 10 search results for that, and 10 also here. If you open the atenolol monograph, it will appear just like the normal monographs that you know from Lexi or Micromedics and all of that. Maybe the ordering is slightly different, but basically you'll find also everything. You'll find here description, mechanism of action, pharmacokinetics, and also you will find the indications and dosage and adverse effects and contraindications and all of that. Now we have to the pregnancy information in clinical key. In clinical key, pregnancy information could be specific for certain medication. So we are here at the atenolol drug monograph. You might be wondering if atenolol could be used at pregnancy. And on the other hand, you might be interested in knowing what are the medications that could be used in a specific topic or a specific disease. So, if I'm asking a question saying what if atenolol could be used in pregnancy, you would get this information from the drug monograph itself. You will navigate for contraindications. Unfortunately, in clinical key, there is no independent pregnancy section, so you'll navigate for contraindications. And the easiest way to go is to press on Control F, and you will get here a search bar, and you will type pregnancy. Okay, you have 7 words of pregnancy in this article. So you can press down. You have to make sure you have searched for them all, for the all of the seven. You have 7 results, and you are now on the first one highlighted here. So you'll press next, and here is the information I want. Atenolol is classified as FDA pregnancy risk category D drug and should be avoided during a pregnancy if possible. As you can see here, it's saying if possible. So if you don't have any other data, you will just write you have to avoid it if possible. But sometimes you are forced to use specific medication that is partially contraindicated in pregnancy, just a benefit risk ratio. The page is to select the search here, and you might type you have to select this page to search only in this page, and you can type the word you want, pregnancy. Let's just close this one here and click on search. You will find a very similar approach. You will find results of 7, and you can press next to find the word. However, I find the Control F to be more reliable and easier to navigate, so you can choose what you want. Okay, now if I want to find the information about pregnancy and certain condition, so I would not find this in here in the drug monograph. I will go back to all types, and I will type pregnancy and hypertension. Now, as you can see here, I have many other databases like guidelines. You have the first one here, hypertension in pregnancy, and it's a nice guideline, which is a very important organization. And this guideline is recent, it's 2019. So if you open this guideline, you will find every information you want about pregnancy. Also, you might not find the clinical overview monograph of the disease of hypertension here. However, if I typed only hypertension, I will get the clinical overview of hypertension. I can open this one, and I can also press on Control F, and I can type again pregnancy, and I will find some information, some summary of what should I do with the special population of pregnancy in the case of hypertension. It will provide you with some information and about the medications to be used. So here, ACE inhibitors and angiotensin receptors blockers are contraindicated because they are teratogenic, and you'll find some summary for pregnancy in this section of the special population here. Okay. Now, if I've asked you how did you get your results, uh, you can get to your account here, and you can click on search history. In search history, I will see your what is the keyword you have used and what is the filters you have applied. So here in the word atenolol, I have applied filters of monographs. Here in COPD, I have not applied any filters. So if in exam I told you what is the filters you have used, you will copy all the section like that. You will copy the word atenolol and you will copy your filter, and you will paste it in your exam. Okay. The last thing, I will show you how to use the calculators. So you'll press on Tools, and you will select Clinical Calculators. Now, the calculators in ClinicalKey, you can calculating some dosage. So you have drug calculators, and what is very interesting here is clinical criteria and decision tree calculators. So you might be interested in calculating some risk regarding maybe the bleeding risk index of warfarin, or maybe something like the TEMI score of angina. You may select this one, and you can easily select the points you want, like age above 65, non-coronary artery disease, ST elevation, and you can here find you got 3 points, and the interpretation of the risk available. It will provide it here. So this can be very helpful if you can use these calculators. Also, there is something called the decision trees. If you want to diagnose, you can just play with this. I'm not going to ask you about those, but they are helpful in your clinical practice if you want to use them. You can find something like here diabetes. Decision trees are called here tree calc. You can press here on diabetes type predictor tree calc, and here a decision tree will appear. You will just select your options. If the initial treatment, the patient is controlled in insulin, you can press on insulin. If the patient is controlled on oral agents or diet alone, you can press on oral agents. So let's press insulin. If the patient has ketosis, you can press yes. If the patient is obese, you can press yes. And as you can see here, uh, the software itself will choose will save your answers, and it will tell you what is the action required. So it's like an algorithm that is slightly interactive. The patient is taking insulin, the patient is having ketosis, the patient is obese. So the action, you have to refer him to a physician. Okay, that's it for Clinical Key and the Egyptian Knowledge Bank. I hope you have learned something new today. If you find any difficulty, please contact me, and good luck in your exam.